My involvement with Treace Medical Concepts was really an interesting and quite frankly, a very enjoyable start. I had been working with a couple of other colleagues and surgeons probably 6 or 7 years before I met John Treace and before the company was even in existence, and we were working on these concepts of three-dimensional correction of bunions. And honestly, at that point, I was really the odd man out in our profession. I was probably the only one, or one of very few, foot and ankle surgeons that were willing to talk and publish about what was at the time a very radical idea. And in some of my discussions with colleagues, the idea that Treace Medical was looking to form a new company based on solving difficult problems in foot and ankle surgery. And I met John Treace, and he invited me to a meeting, and there was 4 of us there at the first meeting. And really we got together just to throw around ideas and see what may be out there as far as needs for foot and ankle surgery, new ideas, or concepts that we could take and really help patients with. And I presented this concept to the group of incorporating frontal plane rotation or three-dimensional correction into bunion surgery. And I had been doing clinical cases at that time, so I showed a series of my results. And the one thing that came out of that meeting was that we were all very frustrated with bunion surgery. Every one of the surgeons had the same issues and concerns and, quite frankly, frustrations with bunion surgery. And so I think just the idea of a new way to look at a bunion from the basic anatomy, and then possibly a new way to do a correction and correct all 3 planes, really, I think, struck everybody in the room, and we really very rapidly at that point started working on the idea. And the goal at that point was to develop a system that would take what is a very complicated correction in 3 dimensions if you do it freehand, and provide instrumentation for it. So that was our task and our goal at the outset, and it was really so satisfying and amazing to see how rapidly we were able to start testing prototypes, and how the engineers were able to provide us incredible support with prototypes. And we went through so many different early prototypes that, quite frankly, didn't work very well, and through trial and error and keeping our eye on the goal of this instrumented correction in 3 dimensions, we were eventually, in about a 1.5 year period of time, able to develop a system that was launched onto the market.